Someone comes into your clinic and they say, I have pink eye. When you hear that, often what that means, how you can translate that, is that that person, that individual, thinks that they need an antibiotic eye drop or ointment. Pink eye is just a blanket term for different types of conjunctivitis. And so when someone comes in and they say that I have pink eye, I need to ask questions. I don't just all of a sudden jump to an antibiotic, because there's different types of pink eye conjunctivitis. Starting with the first one, we'll go with it, allergic conjunctivitis. Typically what you're going to see allergic conjunctivitis is itchy eyes. It might be around a time when the seasons are changing. They may have a lot of sneezing, watery eyes, things like that, and often it's in both eyes. Usually it's in both eyes. And then there's bacterial conjunctivitis. We'll use that one next. This is the one that most people will come in and think that they need an antibiotic drop for. And what they'll come in with is that they will say that they have usually a kind of a gritty sensation in one eye. Usually starts in one eye. It can move to the other eye, but that's just the typical presentation is one eye. They'll have a lot of matting and crusting with that, and then also purulent drainage as well. They usually will have some kind of exposure somewhere to something that presented very similarly, where the person had like green, copious amounts of drainage in one eye. That's not the only thing that it can be, but typically that would be a bacterial conjunctivitis that you do need to treat with an antibiotic. Then you go on to the last one that I think gets missed the most often, which is viral conjunctivitis. Usually viral conjunctivitis is going to be in both eyes, and it's most often caused by the adenovirus. I used to work at a place where it was like an urgent care setting, and we had a point of care tester where we could check for the adenovirus, which I wish most offices had that, but they don't. But we would check that, and the most common thing that I saw usually was going to be both eyes were affected, copious amounts of drainage, and the drainage was clear. I find that viral conjunctivitis hangs on a lot longer. Viral conjunctivitis is typically going to be treated with lubricating drops, artificial tears, and it's going to be something basically to help kind of relieve some of that irritation that they may have, and also cold or warm compresses. And then of course just washing hands and staying away from people as much as possible because of how contagious that it is. Yeah, definitely viral conjunctivitis, that sometimes is the more annoying one, because it really can't, there's not an antibiotic that you can use to treat it. It's lubricating drops and really just avoiding people. It's also important to be aware of other conditions that can cause the eye to be red, even something like ocular rosacea. I had a patient once that came in and was continuously being treated for bacterial conjunctivitis. They came and saying, this is what I have. I know I have this. I get this all the time. They said they had it a few months ago. They got an antibiotic. The thing is something didn't match. Something didn't match. And I said, let's ask more questions. And so when I dug a little bit more into their history, one of the questions that I had was about their chronic conditions, and I asked if they had rosacea, which rosacea can cause ocular rosacea, and then I asked them if they had dry eyes, and they said yes. And then I ended up referring them on to an eye doctor, and I called them later to check up on them. What do you know? They end up having ocular rosacea, and here they were getting treated this whole time for bacterial conjunctivitis. So the big key there is anytime that someone is having any kind of recurrent condition that need to be looked into, because it could be a trigger in their home, and or it can be a chronic condition that's related, causing this thing. So definitely make sure that if you see any kind of recurrent condition that you are looking into that.